Welcome to the Commit to Thrive podcast, where we have committed ourselves to the betterment of physicians, nurses, and executive leaders across the complex world of healthcare and higher education. Join Dr. Todd Redden as he engages with some of the nation's most brilliant men and women to learn leadership best practices, the secrets to personal and professional well-being, and how to build an excellent work culture across complex and ever-changing environments. Now, here's your host, Dr. Todd.
Today, I'm welcoming to the Commit to Thrive podcast a great friend, former colleague, highly respected physician, and consummate leader, Dr. Jaspal Singh. So Dr. Singh is currently a professor with Atrium Health in Charlotte, North Carolina, where he serves as a member of the faculty and practices clinically within the Department of Medicine, the Virtual Critical Care Center, and the Levine Cancer Institute. He is board certified in pulmonology, critical care, and sleep medicine. So obviously highly credentialed, highly experienced physician, but not only is he a great teacher and excellent clinician, I want to welcome him to today's Commit to Thrive podcast because of his leadership experience and the respect that I know his colleagues have for him in this space. He's currently the medical director of the Adult Critical Care Practice and Education with Atrium Health, as well as the Director of Innovation and Quality Improvement in Pulmonary Oncology. And most recently, Jaspal has been appointed as chair of the Diversity, Equity, and Inclusion Committee for Atrium Health, Adult Medical Specialties, where he's a champion and advocate for the fantastic D&I work that I personally know is a passion of his and a priority of Atrium Health. So today, our primary focus is on self-preservation and leadership in a pandemic and post-pandemic environment. So who better to speak to this than Jaspal, who I know is a front leader and clinician during the COVID-19 response, treating critically ill COVID-19 patients and leading teams in the midst of that challenge that the pandemic brought to us all. He can speak in this space like no other. So without further ado, let's get started and welcome Jaspal to today's Commit to Thrive podcast. Dr. Jaspal Singh, again, welcome to the podcast. I appreciate you being here. I know you're a very busy man, but taking the time out to be a part of this and contribute to the lives of physicians and other healthcare providers based on your experience. I mean, man, it means a lot to me. So I appreciate it.
Oh, thanks for having me today.
Yeah, absolutely. So we'll jump right in and really today's focus is around self-preservation and how to manage the unexpected. You've held numerous leadership roles. You've been a physician for a number of years and is well respected in your field. And I'm curious from your perspective, when the beginning of COVID-19, let's talk about COVID-19. At the beginning of COVID-19, I was in Winston-Salem when I heard about the first case in North Carolina. It was just up the road from me, not far from you, in Charlotte, North Carolina. And Wake County announced it. So now it's in our neighborhood and it's right around the door. Tell me a little bit about around that day of March 3rd or thereabouts. What was the response? What were you thinking as you realized that, hey, this is coming?
Well, we had, thanks for that question. I would say we had a few advantages, I think, in North Carolina. Was one that we weren't hit as hard early on as some of the other cities around the country, particularly New York City, Seattle. And then, of course, we had a lot of headwinds that others had faced that we'd heard about from Italy, China, other places like that. So we were fortunately, I think, a little bit lucky that we had a little bit more time to prepare than other areas did. And we knew this was going to be pretty serious. We didn't know it was going to be like a New York, Seattle serious or something different, so we just didn't know. It was scary. I mean, there's no doubt many of us frightened, front line, whether it be home, whether it be for the kids' schools, whether it be elderly family members, we all knew that we had to take this very seriously.
Absolutely. Absolutely. And I know when our governor in North Carolina called the shelter in place and we were trying to figure out if people were going to work remotely, there were a lot of logistical things that were happening in the non-clinical areas of healthcare systems across the nation. But it had to have been scary to not know really what was coming, because at that initial point, the vaccine was still up in the air. People were coming to the hospital diagnosed with COVID-19, many comorbidities associated with that, trying to figure out the best practices from WHO and CDC. I mean, there was so much noise and so much information coming at you without any empirical evidence as to what would be best practice. So how did you manage that?
I'm not sure I managed it or just kind of like managed to just, struggle. I think all of us struggled with this. Yeah. I mean, no one, I think, came out of this unscathed as to how to process information at such a rapid pace with so much uncertainty. And then also the tension around public health issues, information, misinformation, trust of information, sources, who to believe, who not to believe. And then there was a whole lot of extra sort of noise that I think was a distraction as well. The political stuff that was kind of coming through, that was hard. And I think you have to sort of, I think through any crises, which I think you're kind of getting at is, when life is uncertain in these situations, you have to kind of fall back onto your principles. Right? What are your principles? What are you here to do? What are you here? The public needs you. Your family needs you. Others need you to be at your best. And at times it's really hard. You're trying to make the most sense of it, and you have to be honest. And it includes being honest of what you know and what you don't know, what you think is the best guess, and then comes to sort of leadership styles. Do you want to be the rah-rah cheerleader without all the right information? Or do you want to be the authentic leader who recognizes and acknowledges uncertainty? And so I chose the latter. Other people chose differently. And you have to decide for yourself what your team needs at which point. And you have to toggle between the two, just realize that different situations come from different require different skills of leadership. And at times that itself is challenging.
Right. Absolutely. No, that's a great point. And obviously this impacted your world as a critical care physician, but it was impacting emergency departments. It was impacting some of the med surg floors. I know some critical care departments across the nation do not have critical care physicians or intensivists on hand. Many hospitalists were covering these very sick patients, and I'm sure doing a great job. But as physicians are challenged sometimes to connect to purpose in the midst of the chaos, the midst of many of the challenges that just are part of today's healthcare environment. How did you stay committed to purpose and recognize the value that you were bringing, and then continue to support nursing staff and the ancillary staff and your physician colleagues throughout this time?
Yeah, I don't know if I did a great job or not a great job. I think, history will judge and all these things. I think we all kind of did the best we can. I think the things that I stuck with were, and I don't know how successful they were, to be honest with you, but trying to find a role in this crisis that you can particularly be adept at, showing up for work at times when you can, protect yourself and your family, not making excuses for hide behind some kind of, others' concern. Try to be, the work starts well before a pandemic or any other crisis, right? How we create relationships at work. Who do we trust? How do we get information? How do we sort through it? All those things. I mean, I started years ago, and I think they were hugely helpful as we come to a pandemic, from local expertise in our organization to external resources to some of the social media channels that I happen to be on. And I really learned to sort of try to process things quickly, effectively, communicate. And that's the stuff that I'm probably better at than necessarily some of the operations, which wasn't my field. So that's somebody else's role. So in leadership, you have to know when to follow. So in that space, I just followed. Yeah. But the part I had to lead on is the stuff that use the things that I can do better than perhaps the next person, and then try to make the team work more effectively.
Okay, great. And I know part of your area of research and interest is team-based care. So tell me a little bit about how everyone came together using that model and kind of a mental model, so to speak.
Yeah, I think you have to think of the whole team. I think, kudos to we had great respiratory therapists, for example, which, I've been in critical care for a couple of decades now. And I remember thinking respiratory therapists, struggle for respect of the profession. I mean, did they come through? Our critical care pharmacists virtually at the bedside, if they weren't at the bedside, they were on a virtual, they were available readily. I mean, nurses and all of us learned to rely on telehealth solutions and others, and the team expanded. You mentioned hospitalists earlier. They were critical. during the early, especially during those surges, especially, and they're still critical today. Like we recognize that, we need skilled hospitalists and hospitalist teams to manage these very complex situations. And so I think to build and lead teams and constantly lead teams, it takes a lot of work, right? It doesn't just, you can't just study that in a classroom. You got to be at the bedside. You got to learn some of it a little bit, work with the team when the situation's good, and then kind of learn to develop relationships, trust. When you don't have people at the bedside that you can get to, then you find other means. So the pandemic did allow us to leverage telehealth technologies and other technologies that allow virtual communication. So we got pretty good at online communication and other channels. And so I think those are all things that we had to do, noting that team-based communication is so imperative.
Absolutely. Thank you for that. Because, having a clinical background myself and working with teams in mental health and psychiatry, I recognize the value. And physicians are leaders by default. When you walk into the room, the patient turns to you, the family turns to you, nurses and other ancillary clinical staff yield to your expertise and authority, and it's well deserved. But being able to maintain that contact with family and having to deal with some of the sickest of sick patients, not only from a COVID-19 perspective, but just the daily work that you do in that environment. How do you prepare yourself mentally and maintain the energy and the work that you need to get the work done by not showing cracks in the armor, so to speak?
Well, I'll be honest, I did show cracks in the armor. I mean, this was hard, right? From every facet. And I think a lot of us did. And I think having permission to show cracks is probably an important aspect of leadership. And what you do is coaching and other things like that, and which is very important. People don't realize that it's okay. You don't have to be that stoic leader that holds everything inside. And I can remember many moments where the cracks not just showed, but they were just ripped apart. We lost family members, we lost other friends, and along this way to the disease and other factors. And so, we've seen relationships fray, during this whole course. And so let's be honest. I mean, human life is hard sometimes. It's just really hard. And so you take it one day at a time. So the things that work for me, and I don't know if they work for everybody else, you take it one step at a time. You really try to look for healthy relationships and try to really double down on those and to reinvest in them. Try to find meaning in your work. Try to find meaning in your other things outside of work. So I know you do. I know I do have meaningful relationships outside of work as well. And so trying to really do those, and then recognize that they appreciate the humanity of it all. I mean, it sounds crazy. We saw so much death. I mean, it was awful. But then we did see some people come through. We saw some people like actually reconnect with family members. We saw some of the beauty in life. And many of us, on days we weren't working, we're outside enjoying nature. Like how often does that happen during the weekday, right?
That's right.
And then my family and we took daily walks when I was home, or if I was working on a telehealth solution in a telehealth center, my shift ended, I could go for a walk with my kid or play games with my kids, and so you just gotta learn to appreciate the good things. Yeah. And take it one day at a time, because it is hard. And it wasn't just a sprint. It was a series of sprints and a marathon kind of all mixed together.
Man, that's good stuff. I do a lot of work with burnout, stress, and working with physicians, and the coaching work that I do through our organization, the Institute for Healthcare and Academic Leadership. And one of the things that I teach and that I coach around is the importance of taking care of yourself outside of work so that you'll be more effective and more healthy mentally and physically and emotionally within the workplace. So many organizations really focus on how can we create a healthy environment, but that healthy environment has to extend outside of the workplace. Otherwise, if you're not taking care of yourself personally, you'll bring that to work which only compounds the frustrations and the stress within the work environment, right? So to hear you talk about taking time with family and self-reflecting, or just taking a break and taking a walk is I think, so important to that self-preservation.
I would agree with you. And I would also say it's bi-directional, right? You also can bring the work home, which also creates additional stresses. And so, and I also would say that creating the healthy work environment begins with yourself. It takes a lot of effort, right? To massage your relationships, to manage your time effectively, all these pressures, all these uncertainties, and then recognize that what you're good at or what you're not good at. I had a lot of colleagues that suffer with a lot of anxiety with this, aspect. And they're still kind of getting, and thank you for your coaching, because people like yourself are very helpful for them to help manage the very complex emotions and the issues around this. And to be honest with you, burnout wellness and resilience, wherever you call this sort of field, was an issue for us before the pandemic. The pandemic just put like a hammer on it and just hit it home that, we need real solutions about what a healthy work environment looks like in healthcare and other industries.
Yeah. Absolutely. Absolutely. And you and I both have had friends and colleagues who have struggled with mental health concerns and substance abuse and dealing with the challenges in very unhealthy ways. And there are opportunities to reach out. While it may make you feel vulnerable, there are resources to help physicians, not only the work that I do, but there are many others that do great work, as well as resources internally within the healthcare system. So, those that are listening to this podcast, I hope they will take advantage of those resources or reach out and let others be there for them. So you and I have had some talks, sidebar conversations about the frustrations of healthcare, and they're certainly not isolated to any particular healthcare setting, right? Or system. Right. So as we think globally across the nation and maybe even internationally, what are some of the frustrations that you experience or that colleagues within other healthcare systems that you network with may have experienced and could have been done better in preparation for COVID-19 as well as some other factors?
Well, I got to say, I was lucky that I think, first of all, that our organization was on it. I have to feel pretty proud about that. That I know plenty of people struggle with the basics, starting with PPE, personal protective equipment. That was a huge issue early on. If those who aren't aware of how bad it was, we were talking about reusing equipment, gloves, gowns, masks. Even things that you breathed on or, soiled at some point. We're talking about reusing stuff. And so I was lucky that we didn't have to deal with that part of the crisis as much. I thought our health system was really good. Many colleagues, however, struggled with that. Yeah. We struggled with, on all the conflicting information as well. I think moving forward, I think you're kind of getting up. I understand the question. What lessons would I take from here? Right. Moving forward. And I think the first thing is really developing clear relationships, not just with yourself, your colleagues, but also every strata of the leadership structure. I think many health systems are very hierarchical, but high-performing organizations are not. Right. In the leadership models, the people who are able to move laterally, vertically, sideways, all the different directions, who will understand, look, and really see and get to know their colleagues in different directions, are the ones that are going to be more likely to be impactful, successful, and more gratified, especially if they're listened to, especially if they're at least acknowledged, right, in some shape or form. And ideally, deeper relationships. I'm a strong believer that deep relationships also impact your wellness. So the ones I worry about in my circle are the people that don't have an outlet, that don't have someone they can vent to, that don't have someone that they feel isolated. They might have gone through the pandemic and now been, separated from their significant other or something like that, or created a lot of other stresses. And those are people I worry about. So I'm going to reach out to them more actively. I'm going to kind of try to find them and help nurture get them back on a track if I can, if I have the ability or the ability to help them even just in small ways. I think going forward, we also need to make sure that we manage information better. I think that's a societal aspect. I don't think anyone will disagree with that. I think what is the truth versus what is meant to sort of potentially cloud people's judgment. I think we need to come back to scientific rigor and really message that appropriately. So as much as I'm not a huge fan of ton of social media, I stay active on social media because I realize if I don't, somebody else is.
Right.
So I teach physicians and encourage others to really try to experiment with social media, because if you're not, you may not like it, somebody else needs it or someone else relies on it. So trying to understand those aspects, modern communication, other methods. We have a great marketing team, which I think they've done an incredible job trying to get the good messages out. And so working with them has been a huge honor and a huge privilege because I think they're really committed.
Right.
And so things like that, I think, are important. And then, so information, relationships. And the third thing is kind of getting back to where you started, which is really having a growth mindset, recognizing I can only control the things I can control, and starting those things I can control is my attitudes, my behavior, my actions, and that I am myself a work in progress, and that I need to work on myself no matter what the situations are externally. I always have something to learn and grow from.
Yeah, no, that's great. That's good stuff. I appreciate you sharing that, because you're right that if you don't have those outlets, if you don't have opportunities to vent or share or make yourself vulnerable, and we as men, let's be honest, men don't often have close relationships with other men, people that they can connect with. And, I think that personal accountability that we share with one another as we allow ourselves to be authentic and vulnerable, as well as an outlet, is going to help us manage many of the frustrations and challenges, self-doubts, and so forth. Because it is okay to show those chinks in the armor. It is okay to show that we don't have all the answers. As a physician, physicians are very competitive and have a history of being type A, and many of the things that made you successful as a medical student, as a resident, and as a physician don't necessarily help you as a leader. They could undermine you, right? That competitiveness, so what would you tell leaders that are leaders of physicians as well as other staff? What are some of the key takeaways that you've experienced that are very important?
I think, and maybe I'm not, I don't know if my comments were applicable to everybody, but I think number one is, you and I've talked about competencies, and the competencies of true leadership are vast and deep, right? They're broad and they're vertical, like they can go multiple levels. And so what type of leader would I want to be led by? That looks different than my colleagues, And so recognizing that different people want to be led differently, and that you need different competencies to manage different types of leaders is important. You can't just pick. It's just like if I do I tell my trainees, when you're walking into a family meeting, it's the hardest procedure you'll ever do. And they look at me surprised. I'm like, yes, because this can go sideways so many ways. You don't know the other people as well as you think you might do. You can't read, and just giving information isn't really giving them information. Right. It's actually very difficult. And so same thing with leadership. Leadership is hard. It takes a lot of work. You're going to mess up. You're going to have to be honest with yourself and with others that when you mess up, and it's not much different than being a parent of 2 teenage daughters right now, I'll be honest with you, the same skills translate, right? I've messed up this weekend, with one of my kids. And so I have to pull back from that and learn from that and grow from that. And I don't think it's any different than if I was leading a colleague. Right.
No. All right. I appreciate that. So if we were to see another pandemic on the horizon, because right now we're in the middle of flu season, people are challenged with keeping themselves healthy. I don't know what kind of winter we're anticipating at this point, but regardless, if we saw it coming, what would you recommend as a way of preparing, not only logistically, but personally, for something like this on the horizon?
I think there's probably a few things. I probably can't even think about all of them. If I was to really sit down, there's a whole nice series of documents from the Society of Critical Care Medicine and other documents that actually really go into all the different domains of which to think through. But things that come to mind are, number one, are your basic resources, from protective equipment to supplies, ventilators, depending on the type of illness that you have, respiratory or other skin issues, might be wound issues. So thinking about making sure you have the supplies for the anticipated medical need, that you have this people to potentially provide that care, that you have the public health messaging channels being worked on, and you and your teams are well apprised as to what's coming on the pipeline. And as the science evolves, that you have information firsthand, that you have a way to get the information transmitted, that you have clear lines of communication. I have to say, our health system did a phenomenal job having leadership calls every week and kind of a lot of ways to communicate with other people. And I thought that was very well received. People like numbers and data. They like to know the truth because they may not believe what's been hearsay, but if you show them graphs, figures, numbers, that tends to do a better job than rumors and such. I think the other aspect is, getting to know your team and all the people there and all the things that make them tick is something that you have to do regardless of leadership, but it becomes magnified on the stage when you have a crisis. And I think that's true for anything, whether it be a code, a medical crisis or non-medical crisis, family crisis, everything gets magnified and things also get emotional. Right. Yeah. So trying to learn to develop, manage some of those things ahead of time, figure out how certain people respond, how they might respond. I got to say, I was pretty proud of the people I worked with during this pandemic, as much as hard as it was. I mean, people really they really came through, and I mean, in inspiring ways. I mean, I could probably share this with your audience. I was not only managing the pandemic during our first surges, but if you may remember, India had a horrible surge. And so I lost family members along the way. So I'm managing ventilators at night through internet access while in the daytime trying to show my skin. And it was hard. My own parents actually had long COVID, and my dad subsequently died from the effects of it. And so going through that at home while your kids are stressed about schools and what's happening with them, and you see the effects on them, all that was part of my crisis.
Right.
But if my leaders weren't paying attention, only just thinking of, one dimension, the day-to-day work, and they weren't paying attention to other parts of it, I might have felt, isolated.
Yeah.
Or if I didn't have a outlet. Luckily, I have good friends that actually helped with some of that, good family members that really came through. But you can imagine how hard that is for people who have unstructured support structures.
Right.
And so I would also say, if you're a leader, make sure your people have a support structure, and help them if you can. Guide them towards setting up a more stable structure if possible, because when the crisis hits, they're going to need that.
Yeah. Well, I'm so sorry for your loss, but I appreciate your willingness to share that. And you're right. There are so many things coming at you, and it's hard to compartmentalize our lives, right? It's when people talk about work-life balance. I don't believe it's a dichotomy. You don't take your physician cap off when you get home and then put it back on when you walk through the doors at work. So being able to manage that blend effectively while taking care of yourself, because if you don't take care of yourself in the midst of that, then you're probably not the best you could be for your family, friends, and colleagues. So thank you for that. So some would argue we're in a post-pandemic era. Some would argue against that. But regardless, we're certainly not where we once were. And I'm thankful for that and for the great work that you and your colleagues across the nation have done in getting us through this. What do you think are some of the residual effects that we have to manage right now?
I think we're just seeing the tip of the iceberg right now. Obviously, there's staffing crises everywhere. There's financial headwinds everywhere. Some of the pandemic, some of the other factors, but the pandemic had a huge role in that.
Yeah.
There's also, political issues out there right now that are just really, I think, posing a challenge. There's environmental crisis issues kind of happening right now. I think the pandemic has exposed a sense of the stresses. This has exposed some of the stresses out here that are out there. And I think there's a bit of anxiety, whether it's a pandemic or not, or whatever's happening. There's a lot of uncertainty right now, whether it be financial, whether that be environmental, whether it be healthcare related. But in the healthcare industry particularly, I think right now the staffing crises across the board, it's not just physicians or nurses, it's respiratory therapists, the pharmacists, the pipelines, the students, the administration. Many administrators burned out during this aspect. And so you talk about the whole pipeline, the whole team, all having some significant soul searching and some real challenges moving forward. But I will say, though, that on the counter effect, on the positive side, to make sure your audience has something positive to take away, I think wellness, resilience, burnout are now common conversations. Yeah. And I'm thankful for that, because I think we didn't talk about it. We buried it on the rug, or more importantly, we glorified the super hard worker. We glorified the person who put work over everything else. Or we didn't, glorify the person who was a really good family person, And I think we're starting to realize that, work is important. The mission's important, not to take away from that, but the whole being has to have some sense of belonging, purpose, wellness, and we're working through that right now. Yeah. I do worry, though, that some people have made it where they've, I think, oversimplified wellness, where they've made it where, my work is here, my home is here. I'm going to dichotomize it to preserve myself. But now I see a lot of colleagues, especially younger ones, that are missing on the opportunity to really grow. Because what was happening was, in that space of kind of stressing yourself a little bit, you learn so much, not just about the technical aspects of the job, but there's a growth emotionally, spiritually, professionally, in dimensions that you can't appreciate until you're at my stage, mid-career. You've done this for a while. The technical stuff comes easier, but that's the stuff that really sort of gets at you at that next phase of your development. And I worry a lot of my colleagues have now sort of dichotomize so much. Work is here. I'm not going to stress myself at all. And so they don't stress, and now they don't build resilience, and they don't build the other aspects of their dimension that they've so much potential to achieve, but they tend not to achieve it. And so, or they don't even try to achieve it. And so I do worry about that a little bit. But that being said, when I see my kids and there's how brilliant they are, and their friends are, and their colleagues are, I do have a lot of hope at how great these kids are turning out.
Right. No, that's great. I mean, I love that. So take that just a couple steps further as we wrap things up in this session. What advice or what wisdom do you have for physicians who are questioning themselves, who have not done the things that you've described and are feeling kind of frustrated within their role, wondering if they can keep going and maintaining the pace that they're maintaining?
Yeah, I do tell them to really look at their lives and examine it. First of all, listen. What does they want to do? What does they want to become? What goals do they have? I may not know anything about their life, first of all. So I think for the ones that I'm sort of an informal mentor for, I try to get to know them, first of all, because who am I to advise them if I don't even know what makes them tick, right? And then further, try to recognize that, this is a challenge. And so create a deeper relationship with them, and then help them sort of maybe give them tips and pointers about how to balance their life in different ways, or achieve their goals, or nudge them in certain ways. I'll never forget, I had a mentor a few years ago who recently left our system, but it was a Saturday, and I was kind of negotiating a new leadership role at that time. And I'll never forget that moment where he's like, we talked about something over the phone. It was a Saturday afternoon, and both of us were just kind of catching on emails and just back and forth emails. So I called him up. I said, "Hey, I'm struggling with this question." He's like, "What are you doing right now?" And I'm like, "Nothing really." He's like, "I know where you live. Mind if I just meet up for a cup of coffee?" And we did. We spent 3 hours, and in 3 hours, he helped me develop a career plan.
Wow.
And you're like, I'll never forget that moment. This is kind of during that pandemic a little bit, we're just getting started in the searches, but he helped me define a career path. And I thought it was really I'll never forget that. And I'm always grateful for something like that. But when people do stuff like that, and so my job as a leader is to pay it forward, right? When it's my turn, I got to do the same thing. When someone calls me and says, "You know what, I'm having trouble, or I'm struggling with these questions," I'll say, "Let's go for a cup of coffee, or go for some tea, and let's catch up, and let's see what I can help you with."
Well, you've certainly touched on it. So expand a little bit more about what are the advantages of having a mentor.
Yeah, I think mentor sponsors, I think people that are just confidants that you can sort of vent to,
Yeah.
I think they're all important, right? I think the more important part is, they say, the classic phrase, when the student is ready, then the teacher comes, right? You have to have that growth mindset, realizing that you don't have the answers. Right. There are some things I do well, some things I don't. There are a lot of things I don't do well. So from that perspective, what things I want to focus on to do better at, to grow as an individual, as a professional, but also as a father and a member of our community.
Yeah.
And so you have different I'm fortunate. I have different mentors for different roles or needs.
Okay.
Right. And so I'm very lucky to have that. But I think a mentor can help you a lot of ways, recognize your blind spots, help you negotiate stuff, help you through political issues. Sometimes find some resources if you're looking for some resources to get some things done. That can be help. A lot of different roles for the mentors. Sometimes just be a voice of clarity.
Yeah.
As someone who's done this before or been in similar challenges, and just be like, you're overthinking this. Oftentimes they'll tell you, like I've done for other people, I'm like, you are way stressed out about this. You're doing just fine. Just give it time. Continually to work on you have that growth mindset. If you have that mindset, you're going to be just fine. And make sure you find time for yourself. That's kind of what I find myself over and over finding, is the people who come towards me are oftentimes people that are like burning the candle at so many ends, that they just need to be told, don't do that to yourself. Just relax. You'll be just fine. And I'm here to help.
Well, I know Atrium has had a very successful physician mentoring program in the past, but if you don't have a formal program that assists with some of that matching mentors and mentees, what's the best way to find a mentor?
The best way to find a mentor is just to ask. Honestly, sometimes they're readily accessible to you. Other times you might be lucky that in a professional society, so all the major organizations in my field have formal mentorship programs. Okay. So whether it be for mine's pulmonary critical care, so in that, of those three major societies, all of them have formal mentorship mentee programs. And maybe someone you trained with before, someone who you might have had some other interactions with, maybe someone on the hospital side or the clinic side or the different aspects. But oftentimes you'd be surprised at how often people are like eager to help you, because most people in life, wherever you work, want to see you succeed. So for your physician audience, particularly, people put a lot into physicians. I know there's a lot of chatter about, physicians are, this and that. But that being said, I would say the majority of people that I see, and the majority of administrators and other leaders I talk to, they want to see their physicians happy, and more importantly, not just successful professionally, but thriving. Yeah. So if you need something, voice it. And if you don't voice it, the answer is always no, right? If you don't ask, the answer is always no. So voice that. Say, you know what, I need to get better at understanding strategy, or I need to get better at understanding how to talk to certain situations, or I get nervous on stage fright, or I get this and that. There's probably someone to help you with all those skill sets that you want. But you have to first look deep inside and say, what is it do I really want to do? What is it do I particularly need? Can someone help me craft a strategy around that, if possible? And if not, let's explore some of those aspects and let's kind of flush them out a little bit to understand your needs, your desires, and what can make you the most impactful person you want to be, or the person you want to become.
Yeah, that's great. Well, listen, I want to wrap things up, but I so appreciate your time and the wisdom that you've shared with the audience, and taking the time out. So do you have any last remarks or comments that you'd like to share?
No, I just want to say thank you, Todd, for all the work you do in this space, because I think it's really important. I think people need guidance. If they don't have someone immediately, then get a coach or get someone else to help you, because they can really help you in these spaces, really sort of help you, not just for your job, but for your everyday life as well, in so many facets.
All right. Well, thank you. And thank you for the work that you do. And we'll sign off, but look forward to seeing you in person, sharing a cup of coffee soon.
Sounds great. Take care, Todd.
Thanks. Well, that wraps up today's Commit to Thrive podcast. So I'd like to again thank Dr. Jaspal Singh for being part of today's session and sharing his expertise as a leader and critical care physician in a pandemic and post-pandemic environment. I especially appreciate his input around managing physician and staff shortages, personal grit, and the importance of self-preservation while physicians face many of the challenges that exist within healthcare systems across the nation. I've noted in previous podcasts that there's no other career that's experienced as much unexpected flux and change within their career as being a physician. So you take that constant curveball that the practice of medicine and leadership throws at physicians, as well as many other healthcare providers, and place on top of that a pandemic. You can only imagine the challenges and stress, the frustrations that today's physicians face. So nevertheless, they continue doing great work, serving selflessly and providing excellent patient care. So as we are just celebrating the season of Thanksgiving, let's not forget to show our appreciation on a daily basis to our physicians, nurses, and other healthcare providers for taking care of us and our loved ones throughout the year. So on behalf of the Institute for Healthcare and Academic Leadership and the Commit to Thrive podcast, thank you. And until next time, God bless.
That's all for this episode of the Commit to Thrive podcast. We hope you can take away something from this episode that can positively impact your life or those you're in contact with on a daily basis. If you enjoyed this episode, we simply ask that you share the show. To listen to more episodes, please visit our website at ihaleadership.org. Until next time, thank you for listening.